So this time we are going to look at brucellosis. Welcome back, those who have always followed all the videos, and I hope you are picking something. Modrik's is the name, and that's the YouTube channel, Modrik'slectures. And you can also follow me on Gmail, and you send me a question in case you need some improvement in my videos. You need something that you want me to clarify. You can follow me on email via that email provided. As I've said, today we are going to look at brucellosis, and these are objectives that we are going to look at. One is to define the term brucellosis. We are also going to mention the causes of brucellosis, explain the mode of spread, how to diagnose brucellosis, and lastly, we shall look at the signs and symptoms of brucellosis. And here we go. Definition of brucellosis. We are saying brucellosis is also called mild fever or anadolent fever. And the word anadolent simply means rising and falling. So when I talk about brucellosis, it is a highly contagious bacterial infection caused by ingestion of unpasteurized milk or uncooked meat from infected animals or close contact with their secretion. So a person to get this brucellosis, he should have taken or ingested unpasteurized milk or will have eaten the meat from this infected animal which was undercooked or will have contacted the secretion. That is brucellosis, highly contagious bacterial disease. We can also call it mild fever or anadolent fever. And I've said anadolent simply means rising and falling. Cause of brucellosis. The cause of brucellosis is one, it is Brucella species. And when we talk about Brucella species, it means there are many. So what are these Brucella species? The first one is Brucella abortus, and this is from the cattle. The next is Brucella canis, and this is from the dog. The next is Brucella melitensis, and this is from the goat and the sheep. And lastly, we talk about Brucella suis, and this is from the pig. These are the Brucella species that are responsible for causing brucellosis. It simply means if someone is encountering the secretion of the cattle, then Brucella abortus will be the one which will have caused brucellosis. And if someone encounters the dog, then Brucella canis will be the one which will have caused that brucellosis. Mode of spread. We are saying the disease is transmitted by close contact with infected animals, their tissues or meat, blood, urine, vaginal discharge, and aborted fetus. If the animal aborts and you touch that aborted fetus and it was already sick, you are likely to also contract brucellosis. So the disease is also transmitted by ingestion of milk and milk products from infected animal. So with this, if you just touch the secretion of an animal which is sick with Brucella, remember this is a zoonotic disease, you are likely also to develop that Brucella. So that is the mode of spread of brucellosis. Then how can we diagnose this brucellosis? One, we shall base on the signs and symptoms. In addition to that, we shall do blood culture, shall take off a sample for culture and sensitivity, and shall be able to see this Brucella species. Then we can also do bone marrow culture because it concentrates in the bone marrow, even to destroy the formation of the blood cells. So you can do bone marrow culture and you are able to recognize this Brucella species. The commonly done test is Brucella antibody test, which you call BAT. And that's what is commonly used in many hospitals to see that we diagnose Brucella, which is Brucella antibody test, commonly abbreviated as BAT. Then you can also do hepatic biopsy. And lastly, you can also do X-ray of the vertebra. As we have said, it affects the bone marrow. So you'll find in that vertebral column, many of the parts are now destroyed. So that's how you can diagnose brucella. What are the signs and symptoms of brucella? One is fluctuating fever, or which we call anadolent fever. Fever which rises and falls. The person will tell you, in the morning, I was too hot and the temperature was 40 degrees Celsius. But when he reports to the hospital, the temperature is normal and keeps rising and falling. If someone has that history, then know that that is brucellosis. Then you can also talk of headache. There is sweat, and this sweat has an offensive smell. And this client will always report that time and again, I keep sweating when fever comes, and when it reduces, he becomes okay. Then there is arthralgia, which means joint pain. This person has joint pain because the Brucella species is affecting the bones. Other signs and symptoms can be myalgia, which is muscle pain, leukopenia, that is little leukocytes, and we can also talk of anemia. Then the person also can get orchiditis, which is the inflammation of the testes. And lastly, there is presence of brucella in blood. Thank you for listening. These have been some tips about brucella condition. We have defined, we have seen how to diagnose, we have seen the signs and symptoms. Let's meet in the next video as we see how we shall manage this person with brucella and the complications that can come in if we don't manage this person properly. Follow that video on that link on YouTube. Thank you for listening.